kind welcome. I'm trying to learn medicine. Today, Amoebiasis, and after we've done that, we're gonna do leg injury prevention training. And if you participate in the leg injury prevention training, then it's like and we're talking about a disease, internal anatomy, a parasite disease, and feces, and defecation, and diarrhea, and so on. And this is no medical advice, we're just reading about it, and it is part 2. Amoebiasis. Okay. It is a parasite disease found worldwide, but it's more commonly in the tropics. The infection is spread by food or water which has been contaminated by flies carrying the germ from human feces. Travelers in the tropics, especially areas where amoebic dysentery is common, should avoid water unless they know it has been purified, and fruit and vegetables from sources where contaminated water may have been used to wash them. Okay, we have found this information so far that it is spread over flies which were at human faces infected with amoebiasis and then got to water or something else, and fruits which are washed with contaminated water can have also the parasite on them. Iodine-releasing tablets added to the water will kill the amoeba, but they cannot be destroyed simply by boiling water or adding chlorine to it. Okay, boiling the water or chlorine does not work. Iodine-releasing tablets kill the amoeba. We say it around. Iodine, it's iodine tablets. Iodine tablets. Iodine-releasing tablets can kill the amoeba. Boiling the water or putting chlorine into it does not work. Boiling chlorine does not work. Okay, we have it. It is spread by human flies carrying the germ from human faces to food or water. And also food or water can have it, and iodine tablets work, but not boiling and not chlorine. Symptoms: diarrhea. This may be profuse with blood and mucus, amoebic dysentery, or less severe and intermittent. We're going to say just diarrhea. I don't really understand now if this part with blood and mucus is dysentery, amoebic dysentery, whatever. We're going to say diarrhea. Maybe with blood and mucus. We're going to say it. Diarrhea, maybe with blood and mucus. Abdominal cramps. The infection can spread to the liver, and then an abscess can be fed. I don't think we want to say, but we could say fever, sweat, and weight loss. Then fever, sweat, and weight loss. Okay, we're having diarrhea and cramps and abscess. And it persists if not treated. We could say that causes Entamoeba histolytica. We're just going to say it at the beginning. It is the parasite Entamoeba histolytica. Amoeba. The parasite Entamoeba histolytica. Entamoeba histolytica. Entamoeba histolytica. And severe cases: bed rest, fruits replacing. Let's stay away from it. I don't understand what it means here now. And this is no medical advice, so we don't really need for it. If there is a severe or prolonged attack of dysentery, I don't understand what it means. Particularly if a patient is in an area where amoebic dysentery is known to occur. So consult a doctor if you have it. Check stool for amoeba or where cyst, prescribe an anti-amoebic drug. Now, in the last part, I speculated that cyst means all the larvae, but I think we mean if there is amoeba in the stool or cyst in the liver, or something else, maybe that is meant with cyst. I understood larvae. Okay, we have all the information together. Are we able to say them? We have, it is common, Amoebiasis. Amoebiasis. I think amoebiasis out. It's okay. Amoebiasis happens from the parasite Entamoeba histolytica. And amoebic. No, it's not entamoebic. and Amoebia histolytica, and that parasite can carry the germ from human feces to food or water. If food is washed with it, then it can be contaminated, and boiling does not work, and chlorine does also not work. Iodine releasing tablets kill the parasite. And Amoebiasis histolytica. And the people have diarrhea, with blood and mucus maybe with blood and mucus, and they have abdominal cramps, and maybe a cyst at the liver which can be felt. And okay, let's look if he's safe in anything else. Sometimes no symptoms, but the disease can be still carried. We could say that even as the end, but it would be quite good. And if not treated, persist indefinitely, these two things. Then we, not the thing with that not. We said the thing with the cyst. We could say there is an anti-amoebic drug. Replacement of lost fluids. That's diarrhea. Maybe bed rest and that sounds too harmless. Lost fluids can be replaced because of the diarrhea, but there is anti-amoebic drug. If not, how could we try it? What did I say? How would we try it? No, it's Amoebia histolytica. How do I come anti-amoebic all the time? Amoeba histolytica. What is opposite? Amoebiasis. It is from the parasite. Let's look up how it comes. Amoebiasis. It comes from the parasite Amoebia histolytica, and it can be transmitted by a fly coming onto human faces and transport. No. I want to say also that word. This is about a parasite disease affecting defecation in faces. Amoebiasis. Amoebiasis, it comes from the paradise, or is transmitted. No, what is it? No, it is actually the thing. It is the thing. It's transmitted by the flies, and the other thing is it. This is about a paradise, not a paradise. What is it even? Parasite. This is about a parasite disease and one which affects defecation and human faces. Amoebiasis, it is the parasite Amoebia histolytica, and it can be transmitted by flies which are coming onto human faces and then transported to food or water. And if vegetables are washed with contaminated water, then vegetables can also have it. And boiling or chloride does not work to kill it. Iodine releasing tablets should kill the parasite. And the symptoms are diarrhea, which can have latent mucus and also abdominal cramps. And it can also spread to the liver, and then a cyst can be felt there. There are anti-amoebic drugs, and there are also people who have no symptoms but still have it, and if it's not treated, it is indefinite. And that is according to Keith Hodgkin's Family Medical Advisor, page 72, but this is no medical advice. I think we did it, so I'm going to stop the camera. And that was whatever it's all. That was for medicine part. If you're here for medicine, you can go directly to the next part of medicine. If you stay here, then you can participate in the leg angel prevention training, which we're going to try now. If you stay and participate in this video, then go to standings. Stance, which is actually correct. I just bring our leg, the flex foot to the side. And the other leg. Swing it in front. Anti-amoebic. I think there was another amoebic. Anti-amoebic. Anti-amoebic crystallization. Next exercise, both foot in front and back. And the other leg, bring it in front again. And the next exercise, one leg up, breathe in. One leg to the side. Again in. Out into the middle. Down, other leg up, breathe in. Out to the side. And in. Out to the middle. Down. And next exercise, one leg up, arms out, and bring the arms over to one side. Most of the butterfly. Don't fall over. And on the other side. And now the arms over to one side and the leg to the other side. And change. And down, and now the same with the other leg. The leg up, and we bring the arms out, and we bring the arms to one side. Middle over. And now arms over to one side, leg over to one side. Change. Middle, down. And we're doing the next exercise. How open it from the preceptor. Good standing leg with exercise, kicking out to the knee. We're turning over to the knee. We're going down. Out to the other side. And up. And again, good standing. Out the leg. Down. To the other side. And up. And now the same with the other leg. Good standing. Turn over to the leg. Go down. Another time. Stand good. Turn over the leg. Up. Let's do a clock. Can go again on the knee. So this exercise can go on the knee. Stand good and go with the other foot always in 90 minutes intervals to all of us. 90-minute intervals on the dial. And to the left. And now with the other leg. Stand good. Leg front. Where? 10, 9, and half past 7, and 6, and also way half past 4, and 3. And now let's do repeat pets. Don't do this exercise if you're pregnant. Heel onto the ground, lift the heel off the ground, and place it again onto the ground. Upper foot onto the heel onto the ground, and lift it. Heel off the ground, and place it again. And the next exercise is stand, knee up, down. And the other leg up, down, down. And we make our exercise. One hand on tummy, one low back, and lift the leg and straight line up with the flex foot. If the quad muscles cramp, then bring the foot up, leg up, and point with the foot down. So, bring the leg up. Flex foot, try to bring the leg higher. Control with the hands with your downfall back. And bring the leg up and point the foot down. Try to relax the leg. Again, one hand on tummy, one on low back, and lift the leg up. Try to bring it high. Flex foot and try to bring it higher. And bring the leg up. Pull the leg up, point the foot down, and try to relax the leg. And now the horse. Leg in and out again, in. And the other leg in. And now the camel. You can do also the horse with the stem or the rest. Now the whole body comes down. And the other leg up. Back. And with another exercise you can do the rest. The stem for horse or the camel. Or you do that exercise. You swing the whole leg back. Have a flex foot. Lift the leg. Stand taller with a standing leg. Try not to fall in the abdomen. And the other leg. And ending. Next one part, breathing it on. Breathe it out. Okay. previous class colleagues. Hope you get out of it. Force for leg injury prevention training. I thank you very much. Next time.